Good morning. This is an emergency. I'm convening an emergency meeting of the Kaufman County Commissioners Court. It's Tuesday, March 24th, 2020 at 8:30 in the morning. We're in the Commissioners Court meeting room in the Courthouse Annex in Kaufman. I'll read the beginning opening sentence here, which is due to the ongoing COVID-19 pandemic and the imminent threat it poses to the public health and safety of Kaufman County and its citizens. The Kaufman County Commissioners Court finds that this emergency meeting is necessary. We have a quorum. We have all members of the court are here. So let me lay out a little bit about what the process for this meeting will be. I've provided a couple of documents to the commissioners, which are literally hot off the press. They have not had a chance to read these. So first thing that we're going to do this morning is we're going to hear from Dr. Brazier, our county health officer. I just asked him to come and give us his input on the current situation. Then we're going to discuss the declaration of a local disaster. After that, we'll discuss a shelter-in-place order that you'll have a copy of, and then we'll discuss and consider extending that order, because the shelter-in-place order would only be good for 7 days. I think what we'll end up doing is because of the document that you presented, I know I see y'all feverishly reading over there. I think what we'll do is we'll hear from Dr. Brazier, and then I think we'll recess this emergency meeting. We'll go ahead and conduct our 9 o'clock meeting. We'll call that to order and conduct our regular 9 o'clock meeting. And then, based on what you guys give me the input, we'll reconvene this emergency meeting after the 9 o'clock meeting, however long it takes y'all to read this document, so we can have a better and fuller discussion of these items on the agenda. So, first thing is I'd ask Dr. Brazier if he would call and give us an update in your perception of what our current situation is.
Thank you, Judge. Good morning, Commissioners. My intention here this morning was just to make sure that I was available for questions and to also just kind of try to assimilate some of the information that we've been seeing. I'm sure everyone has been keeping up with the different news reports that are out, the different shelter-in-place orders that have been coming out. From a medical perspective and a medical community, I think that most of us are on the same side of the page, which is to say that the most conservative and the most medically appropriate thing to do would be to limit contact with citizens with each other. And that's kind of the whole idea of social distancing. That's the whole idea of why we started this in the first place. And for lack of a better way of putting it, I think the idea of social distancing all by itself, along with good personal hygiene and washing hands furiously dozens and hundreds of times a day, those methods could be and would be extremely effective were they better adhered to. And I think just what we're seeing based on human nature, based on the needs of our citizens, the needs of people to get out and do the things that are essential to their lives and their families, we've found that advising social distancing has reached us to probably a pretty good amount. But according to the numbers that we're seeing, it does not appear to be flattening the curve quite enough. And so I think that from a medical perspective, again, obviously I'm not able to take all of the economic considerations in mind, but from a medical perspective, the best way to combat this virus would be to limit as much as possible the different times that people connect and contact with each other. I think ideally, in an ideal world, we would have plenty of tests available, plenty of very rapid tests that we could test asymptomatic people. We could test people once or twice a week, because it can be negative one day and turn positive the next day if you've been exposed recently. There's no easy way of explaining why we don't have really great testing other than to just say we just don't have the volume of tests available. We don't have that capability. It's not something that we could have created a month ago or a week ago. It's something that maybe if we knew about it 6 months ago, we could have enough tests. to really accurately identify where it is in the population. So I would encourage you to understand that the lack of testing is not from a simple oversight. It's just something that is very difficult to do. It's not something that can be done accurately or effectively in the short period of time that we've known about COVID-19. My other piece of advice would be to make sure that any information that the commissioners use to make decisions, I would request that it comes from a reliable source. Just in the times that I spend perusing the internet, looking over different sources, even that appear to be legitimate, sometimes as you dig down a little bit deeper, you discover that the credibility is questionable. So if you have questions about the source of information that you're reading, please feel free to give me a call, give me a shout, or ask one of our friends at the DSHS to help vet that information. Specifically, I'm referring to medications that may be out there, treatment plans, different types of things that may help prevent quick fixes, so to speak. I can pretty much guarantee you that if there's a reasonable and appropriate and effective quick fix, the CDC is going to be the first to know about it, and then the DSHS will be the next, and then we'll be disseminating that information from a very official position. So it's pretty unlikely that you'll find something yourself through those kinds of research or information that you may be receiving from your citizens, from different people. So I would ask that you vet that information before you use it to make any kinds of decisions. So, and I'm going to stick around if I can for questions. Obviously, let me know if there's anything else you guys have questions about.
How many beds do we have in the county, do you know?
Hospital beds?
Yeah.
I'm not aware. The hospital system is going to be qualified for the number of beds, and you'll be able to read that on their website. But honestly, the better answer to that is what kind of staffing do they have? Because the number of beds they have, that's the official number, is not a true reflection of the number of cases they can take. It's much more going to be on a hospital by hospital basis, depending on their staffing, depending on how many units they have. That
Sure.
can do that. So,
yeah. Even if they've got the physical rooms, if they don't have the staff, that's irrelevant, I guess.
correct.
Commissioners, anybody else have questions for Dr. Brazier?
Doctor, do you have any idea how many, what the ICU capability of the county is and ventilator capability?
The Kaufman Hospital, Texas Health Resources, has 11 ICU beds, and my understanding is they have 11 ventilators. I could easily get that information for sure and let you guys know. I'll double check with Denise Clausen. She's our CNO or COO of the hospital, and she'll be able to tell me their exact numbers right now.
Yeah, I'd like to know that. Second, Kaufman Hospital is essentially our only substantial medical facility, correct?
Doctor, could you, I guess, explain why there's so much panic and everything about this when numbers of influenza are much higher? What's the difference between these two viruses that's making this so much more dangerous, I guess?
In a nutshell, it's because of the novelty of the coronavirus. So the idea of a coronavirus has been around for decades. I learned about it in med school. So that's not new, that types of coronavirus can cause cold and flu-like symptoms. Okay, there are dozens of different types of viruses that can cause those types of symptoms. Influenza is one of them, coronavirus, there's adenovirus, there's parainfluenza, there's several different names of those viruses. So the uniqueness of this one is that COVID-19 specifically is one of those types of a coronavirus, and we did not have that in the human population or had never been identified under a microscope before it was identified in Wuhan, China. So once it was identified and it was seen to be causing significant symptoms, then it became much more concerning and much more possibly alarming to us. But again, because we had so few numbers of cases of COVID-19, we did not know how to predict. So with influenza, which is a great example, it's highly contagious, it's a common entity, it causes deaths in the United States. It's a good comparison, except that over the last 40 years, we've got hundreds of millions of cases of influenza that behave in a very similar fashion. Now, there's many, many different types of influenza, which is why you need a different flu shot every year. But kind of luckily for us as a human race, most of those types of influenza tend to respond and react and infect us in much the same way, and so we're able to make predictions. There are exceptions to that. You've heard of H1N1, the swine flu, you've heard of the avian flu. Those particular ones we identified, said, hey, that's a novel influenza virus. There was concern, and then as we watched it, we determined, okay, its infectivity, in other words, its ability to replicate itself and become dangerous to more and more people, appeared to be somewhat limited. We're able to contain it, we're able to monitor it, and eventually it died out in much the same way as other influenza viruses have. And so that's why it's different. And some of the numbers that are important that we initially followed were two things. One of them was what we call the infectivity number, which is, we call that R0. So if you see that R0 in a graphic, that's what it's referring to. And that particular number for an influenza virus is usually right around 1 or a little bit less than 1. And that the way to think about that is, for every one person that has influenza, how many people will also get influenza? And so it's usually less than one person will get influenza from that one person, that R0. With the numbers that were coming out from the early stages of the COVID-19, it looked like that number was around 3 to 4. And that may not sound like much, but it does not take long to begin to double and exponentially go up when you're above 1. Essentially, if you're at 1 or below, then the virus will contain itself, and it'll be self-limited, and you can see how eventually fewer and fewer people will get the disease, and they'll isolate themselves long enough that they will not transmit it to other people. So that R0 is kind of a big number. And then the other number, which is extremely debatable at this point because we just don't have a total volume of cases to know for sure, is the number of fatalities per infection. That's where you might have been hearing about the 0.6, 0.7, 0.8% for influenza. So in other words, 0.8% of people that get the infection potentially would be fatal. That'd be a predicted number. And with COVID-19, that number, especially from the numbers that were coming out early on from South Korea, from China, and then from Italy, that number has ranged anywhere from 3.5% all the way up to 6 or 7 or 8%, which is a much higher number. And so obviously, if you have that same level of infection, if we were to extrapolate in a very scary way that it had the same number of people that were infected with influenza right now in the United States actually had COVID-19 instead, then the numbers of deaths would be massively different. Luckily, we're not quite at those numbers, and so we hope to never get to those numbers, but we just don't know how this virus is going to act. We don't know how quickly we can rein in that infectivity number.
Okay. Thank you.
I guess.
So do we have R rating? I mean, did you say that? I mean, you said 0, but where are we on that chart now?
Unfortunately, we don't have an accurate one.
No.
We have some estimates. So we have hundreds of millions of cases of influenza, and over decades and years, we've been able to come up with percentages and numbers, right? But we have couple of 100,000 cases of COVID-19, which has given us a better picture.
Right.
But again, we still are not even at, we don't have the length of time that you would say to be accurate. Because we've really only had one winter of COVID-19. But we've had hundreds of falls, hundreds of winters, hundreds of springs of influenza. We can see what happens with that. We don't know what's going to happen in the spring or the summer or the fall or the winter again of COVID-19 part 2.
Yeah, and I guess that was part of my other question was going to be because, you don't see our flu virus below the equator too much. It doesn't seem to like hot weather for some reason. And does you think this one's going to be affected by? Because I noticed that they're popping up in Peru and everywhere else in South America is starting to pop up.
Yes, sir. Part of the reason for the lack of a summer flu season is really not because the virus doesn't like warm weather. It's because there's fewer people close together. And
they just spread out in the summer and you just
get more spread out and there's less infectivity, which is why we're so confident in telling people if we can do this social distancing, we can make a dent. We can make a huge difference.
Okay.
Is because we know that from other infections of any kind, not just influenza. But
everybody gets outside and breathes and quits.
It can certainly, we presume, based on what we know about infectivity, yes, sir, we believe it will help. And so we're just trying to artificially create summer-type environments by keeping people away from each other
Right.
and limiting that exposure.
Works for me. I mean, I'm with you. This, and I think maybe in our situation, not necessarily Dallas, but maybe in West Texas and other places, the population is so thin and spread out more. They're not going to have the virus as bad as New York City or Miami or Los Angeles.
Theoretically, yes, sir. That's exactly what we hope for. Is the less congested we are,
The better.
the better off we'll be. I think there's just not enough numbers to be confident of that,
Right.
and to say that everybody should probably still follow pretty close to the same advice and precautions. But yes, sir, we hope so.
Yeah.
So how do those numbers relate to Kaufman County? I mean, do we have a basis? Do we have, from what's happened everywhere else in the world, can we project where we're at in a timeline in Kaufman County when it's expected to peak, or where we're at as far as our cases now, or what can we expect in the next 2 weeks here? And I know we're not a metropolitan area, and I don't know if you can get data from like outlying areas of New York City or whatever to kind of get that kind of data to kind of have an idea how it should progress here.
Yes, sir. There's several factors that go into that answer. None of which I'm hoping none of which give you a firm answer. There's not a correct answer to that. There's some ideas that can go into that factoring. One of the most obvious being that we're less congested than the metropolitan areas, so obviously we're going to have less spread. So yes, that's one of the reasons why we're going to be A, behind the curve of getting the first few cases here, and B, when we do get cases here, the spread will be somewhat mitigated, somewhat. So yes, sir, that's absolutely true. The other factor to keep in mind is because of our lack of testing, and I'm not just saying that Kaufman County has a lack of testing, I'm just meaning all of Texas, all of the United States has a huge lack of testing. The actual number of test kits are going to be more concentrated in those metropolitan areas, and so those numbers will also help them to be a little bit higher. So because of the constant travel, because of the commerce that occurs between our county, between Dallas County, because many of us could probably name at least a handful of people that we know that were on an airplane in the last few weeks, we know that the spread is not going to be completely isolated here theoretically. And we are likely to be affected right now, which the more likely answer to us not having a current case, and as far as I'm concerned, as far as I know, we don't have a Kaufman County positive as of this morning. But the likely answer to that is probably not because it's not here, it's simply because it has not been tested, and because the person who did have it did what we advised and stayed at home and has recovered, because, again, even with those scary numbers I was giving you before, that still leaves a huge majority of people that do recover and do well. And so hopefully, possibly, maybe, that those people that have had it were able to recover at home already. But again, that does mean that it's probably somewhere in our community, it's probably somewhere in our county. And so for us to wait until an actual laboratory confirmed positive case is produced is probably a little bit reckless, in my opinion, to wait for just that moment to make decisions. And I don't think we've been there. I think we've taken some proactive measures. We've done the social distancing. We've declared the disaster long before. So I think we're ahead of it. But I'm just saying I think we can continue to be ahead of it and to not wait a major decision based on when that number turns positive.
I guess too, if you would, while you're explaining some of that stuff, tell us the difference between and I don't know the terminology myself so well, but the community transmission of the disease, of the virus, versus how it got started by coming in.
The original cases of the virus that we knew about that had affected United States citizens or Americans that were all Americans that had traveled abroad and that had been exposed in another country. And at the time, we were hopeful, like some of the previous iterations of some of those diseases we mentioned earlier, that it would be more of a self-limited and we could isolate those people and that we could prove that really your only major danger would be if you actually were in an area that had it endemically, in other words, that had it out in the community. And so our hope and our plan was to really designate only if you've traveled are you even at risk. Once there was significant community spread, I think we learned more, and I don't think that that's actually really a factor anymore. So travel really is not important, simply because we recognize that one of the things that we learned was the incubation period was quite a bit longer than the typical influenza. And so we knew that there was quite a few asymptomatic people that had come back from travel and had spread it already, even when we were thinking, hey, only the ones who traveled can possibly transmit this. In fact, we had hoped and thought that the ones who traveled and were symptomatic were the ones that we had to really be concerned about. I think we've learned differently. So I think that just the travel criteria is no longer valid as far as who may or may not have the disease. We have to just presume now that it's in our community and is very likely to be spreading quietly and underneath the surface.
And another thing I'd like for you to kind of tell the public, I guess sanitary measures and using protective equipment like gloves and masks and stuff like that. I know I was involved in that in my years as being a paramedic and then hazmat and stuff like that. I mean, there are techniques that you need to follow when you're using gloves and removing the gloves and taking off your protective gear, or you can get contaminated again on the other side.
Right.
You know, the people are really doing a good job with the social distancing. They're trying to wear gloves, handling money and stuff like that. And sometimes I think that's, I'm trying to say that a false comfort or whatever, that they are taking care of business. And you know, through my eyes, I see them taking my money and running the cash register and stuff and doing everything with their gloves. And they don't really understand that it's no different than using your hands.
Right.
So I think we need to do some type of education for the people that are trying to do that, you know.
Yes, sir.
Basically, wash your hands or wash your gloves.
Yes, sir. I'll go on record and say that washing your hands immediately after every interaction is much more effective than wearing a pair of gloves for a prolonged period of time. It's much, much more effective. Soap, just plain soap and water is absolutely your best bet. And to wash your hands dozens and dozens and dozens of times a day, regardless of your occupation or what you're doing or what you're touching, is absolutely a great idea. And wearing gloves does not prevent you from still needing that. If you choose to wear gloves, you should wash your gloved hands dozens and dozens and dozens of times a day. Right. So it's really pointless to wear the gloves for a prolonged basis. It makes sense in a medical setting because they're single use. You are able to protect yourself from whatever you have to get involved in with that particular case. And then as soon as you leave that environment, you accurately and carefully remove those gloves along with the gown and the face shield and the mask that may also have come into contact with body fluids. That's the intent of those. And those are single-use entities. And we do not have an infinite supply of single-use personal protective equipment. And our medical personnel are much higher risk of contacting and contracting diseases if they don't have personal protective equipment, because they've got much more infectious people that are coming at them on a regular basis. So for them, just leaving the room and washing their hands will not be as effective. They need that personal protective equipment, and then after they get out of that, I guarantee you, they also still wash their hands.
Yeah.
But it's imperative, and I'm glad you brought this up, because it's imperative that we don't have hoarding of that particular type of equipment, lest we become out of it at a place like a hospital setting where it's much more needed and much more necessary and can only be used one time, because it should only be used one time appropriately. The exception would be if you are sick yourself, if you have fever and a cough and you use a mask of almost any kind, it's going to help mitigate some of that. You don't necessarily have to have an N95 mask if you're the one sick, because you're going to reduce that droplet spread, just because when you do cough or when you do sneeze, it does help kind of reduce that airborne spread. And so I do understand the idea of using a mask, but only if you are sick yourself, which is why when you arrive at a medical facility, one of the first things they'll do is give you a mask. If you're going in because you're sick and because you think you might have these symptoms, one of the first things they'll do is give you a mask and then escort you to a more isolated room to help you with maintaining that isolation. But But wearing a mask just randomly because you think you're protecting yourself is not accurate. There's just way too many other ways for it to get in, around the mask itself, the eyes. I mean, if you think about how many times a day, a mask is not exactly comfortable. How many times a day do you reach up and adjust it and try to move it because it tickled your nose or whatever reason like that? If you think wearing a mask all day long has helped you, it may have actually made it worse because now you're touching your face even more than you had before. So I would warn against that, not only to help protect and keep the numbers of equipment available for our hospital staff, but also because it's really not effective.
I have two questions about the comparison between the flu and the COVID-19 virus. You said these, but I just want to make sure I'm clear. One of the differences is that the COVID virus is more of a lurking thing, and that it from the time you become infected to the time you show symptoms can be, we think it's longer than what it would be with flu?
In most of the studies we've seen, it looks like it could have an incubation period. That's what you're talking about. Could be anywhere from 2 days, which is more like flu, all the way up to possibly 10 or 11 days, and there may be some studies where it's higher than that. I think that's why the 14 days came out as a safeguard.
So that makes it inherently more dangerous for the public because you're not.
It makes it more easily transmissible because of people not knowing or realizing they are currently. They have virus in their body, and they're possible to transmit it.
Then the other question is about the flu. What we know with all of our years and years of experience with the flu is one person gets the flu, typically will transmit it to one person.
Or less, correct.
But do we know what the numbers are? And I understand the exponential effect of having, if you affect 1 to 2 instead of 1 to 1, that skews that line up pretty fast. So, but we don't know what
we don't, and we're hopeful that with better testing, that we may actually find that it is closer to 1 or less than 1, and it may be that we end up realizing, okay, this is about as infective as influenza. Therefore, we can make different decisions moving forward. But I would hesitate to hope and pray and wish for that number to be like flu at this point, simply because the numbers we've seen have shown that it looks higher than flu right now. And so I'd rather err on the side of caution with that number.
The only way we're going to know that is looking back in a couple of weeks or whatever and see if we've got that exponential growth. And that's the only way we're going to really figure it out, right?
Well, yes, sir. And respectfully, I would say probably we won't know that for years. We won't really know for years until we have many more numbers. But we'll have a better idea as time goes on. So, yes, sir, every time we get an exponential number that goes up, the good news behind that is, okay, now we've got some more data. And medicine, if nothing else, is driven a lot by data. So, yes, the decisions we'll make will be better once we have more data.
Okay. Anybody else?
So, back to our true purpose here is to discuss, or at least to consider this, the shelter-in-place order and the extension of our disaster order. So I think it's critical, while all of those medical factors are and information is important to understand, I think it's critical for us to consider the circumstances that our county finds itself in, right? As we discussed earlier, we have limited health care capability in the county. The reality is that the vast majority of our population, 50 to 60%, reside in the northwest part of this county, which is, for lack of a better term, a suburb of Dallas. So as the Dallas, as a related community's healthcare bell curve goes, so does the majority of our populations, or the impact on it. And then related is we also have not only limited medical facilities, but limited healthcare staffing as well in this county. So I think it's really important to not view Kaufman County just as an isolated, even though we do have a lot of our geography that is rural and has sort of inherent social distancing, we have a huge population number that really doesn't have that luxury. They really exist in an urban or at least a suburban environment. So I think those kind of factors need to be considered by the court as we make our decision on this particular order. I think we are, like it or not, we are inexorably tied to Dallas and to Dallas County's capacity to deal with this. And I think also it might be very likely that a large number of our county residents, really as I said, they're suburbanites for Dallas in large part. They shop there, they work there, they probably, a lot of them seek their medical care in that Dallas County environment. So it's possible that some virus numbers, some of this COVID-19 numbers might be actually present in Dallas County's inventory and not yet shown in Kaufman. So I just think that it's important for us not to view ourselves as a more remote, isolated county, but we really do have to consider the demographics and how tied we are to Dallas. Unlike many other surrounding counties, Collin County, Tarrant County, even Rockwall and Ellis for that matter, they have in those counties better existing medical facilities and capabilities than we have here. So I think that's another reason why we really need to consider at least application of Dallas's actions and their standards over there.
Yeah, every time you go to Walmart in Kaufman or Brookshire or the grocery store in Brookshire, you're going to be in there with people who just came from Dallas County. Yeah,
Sure.
Anybody else have any questions for Dr. Brazier?
No. Do you think that that is a concern? I think about that. I've thought about it a lot since it showed up. Next winter, I guess. I mean, again. I mean, is it going to come back just like the flu? Now we're going to have this every year. I mean, isn't that kind of a scary thought? I mean,
Sure, it's not very likely that the exact same strain will come back in the same numbers if we can use the numbers that we see from other strains. The influenza strain is a little bit different every year. And so sometimes it's worse than others. You'll hear about this flu season, there was 2 times or 4 times the number of deaths as there were last flu season. You may have heard that
this
in the
year.
past.
Yeah, I think 23, 24,000.
This year is supposed to be is worse than last year, but I think 2017 was one of the worst flu seasons we've had on record. And so we don't know is the first answer to your question.
Right.
But it is, if you look at just
Because it's here and it's
microbiology
not
in
going
general,
away.
we hope not.
Yeah. Sure. I got you. Yeah, it is scary. It's just like on my street, I have 2 Dallas police officers. One of them my son, and then his wife is also an emergency room nurse.
Sure, and many of our medical staff have 2 jobs.
I have 2 doctors.
A lot of our nurses, a lot of our techs, a lot of our hospital staff works at Kaufman Hospital, but also works in a Dallas hospital. So.
Right. So I don't know how you get away from it, except by distance.
Except by social distancing. Yes, sir.
Okay, thank you, Dr. Brazier. We really appreciate it. Sheriff, will you ask if Ray Dunlop is out there, if he still wants to speak to us? Good morning.
Good morning.
Step up to the microphone and tell us who you are.
I am Ray Dunlap, 15022 Saddle Ridge Circle, Terrell, Texas. Thank you, Judge and Commissioner. I'm here representing the Terrell Economic Development Corporation, as well as Mayor Rick Carmona. And first of all, we know that you have some difficult things in front of you. We're very aware of that. And we want to protect the safety of people. We're just asking that any order that you put in place also take into consideration the people that are trying to work, keep their houses, keep their cars. in talking to our manufacturers, they're already practicing social distancing. A number of them have cut meetings out. They don't meet with people outside. They are, excuse me, they're working to keep their people separated. And so we hope that you'll consider those essential work.
Thank you, Ray. Appreciate it very much.
Thank you.
Sheriff, would you ask Randy if Randy Jones is still out there? She has.
Hello.
Good morning. Will you tell us who you are and where you live?
Brandy Jones. I'm in Forney, Texas. I'm the owner of Cooper's Cottage Childcare. Can I ask a couple of questions before I speak? Is the current mandate that y'all are proposing going to exclude childcare still?
Yes.
Is it going to allow for a waiver for businesses that want to put certain protocols in place to go ahead and operate, even if they're not considered essential?
There's a one-sentence line in that order that that offers an opportunity for. We realize that, or I think it's obvious that there's going to be some circumstances that aren't necessarily that we can't consider every single circumstance. So, in that order, which is still, I mean, we're not anywhere near decided yet what we're going to do about that, but. That order has a language in there that someone could come to the emergency management, the Kaufman County Emergency Management, and explain what their situation is.
Okay. Forney, yesterday, I was at the meeting that we had yesterday at the Forney City Council, and they have in theirs a waiver where a business can submit online a waiver to operate as long as they're making certain protocols. I highly suggest y'all consider making that for all businesses, even the essential ones. I was able to walk into this business, nobody checked my temperature, nobody asked me if I've had a fever, no one's checked me for symptoms, asked if I've had symptoms, and we were standing at one time, 9 of us in the hallway, very close proximity to each other, and there was no safeguards. Yet 3 people during the last hour that I've been standing out there have come in wanting registration to go past us, and they were simply asked, do you have a fever? Do you have a cough? Do you have difficulty breathing? No? Okay, go in. Meanwhile, I saw dozens of people coming in and out for this meeting and signing in with no protocols at all. My daycare, for 2 weeks now, every single person that has entered our building has been checked for a temperature outside of the building. Every single person has asked screening questions and checked for problems breathing, coughing, respiratory issues. We've asked them if they've traveled. We've asked them if they've been around family that's traveled abroad. We've asked them if they've been exposed to anyone of COVID. I didn't hear any of those questions out there, and I didn't see a single thermometer. I saw a small deal of Perel that everybody's touching, and then everybody's touching everything. People that have come up and spoken have touched this. There are certain safeguards that businesses can put in to make our limit our exposure and limit others' exposure, including this place, because y'all are our lawmakers. We need y'all safe. We need y'all ready to make these changes. And if it's not even happening here, how do we expect others to do it? So we need good examples here and in our businesses. But give them chances to make protocols. Give them, like hair salons. I helped 2 hair salons last night in Forney come up with what they're going to do for their waiver so they can keep business going. Because if they close down for an unknown time, they are not opening back up. We are small businesses that need to stay in business. But they're putting in their waivers that they'll have 4 salons, barbers working at a time, 4 clients at a time, no more, giving a 2-person waiver. So if somebody walks in with mail, a delivery, because deliveries have to continue for businesses to go, they got to bring us our sanitation products. That gives a waiver for if a child comes in as a client, there's a parent there with them, and they've got that little bumper of 2 people. But there's different things that we can put in place that gives them directive, because businesses don't know what to do. And those barbers had no clue what they could do to try to make their business safe to work and continue on. Like, I don't know where you're sitting. Where's Hunt? He mentioned about the gloves and the mask. People don't understand. They think they just put the mask on and the gloves on and they're safe. The mask can make them more sick because they're sitting there having moisture that goes into their lungs and can help this stuff develop faster. People don't understand the gloves don't keep them safe. That just spreads it because they stick to that outside of the gloves and they're not washing those gloves. It's better to just practice washing your hands nonstop. If you'll give the direction to the businesses and give them what steps you want them to take before they can open safely in a secure manner and still survive. We are a small county and small place of businesses. We can't survive if we close. I'm lucky because I'm in a business that is essential, but a lot of my friends and my parents of the people that come to my childcare, they won't have businesses. They'll be on unemployment and they'll be on assistance for years to come if their businesses close.
Thank you for your comments.
Thank you.
I'm going to go talk to Steve for just a second to see if he has anything he wants to tell us about that.
Well, y'all heard me ask him if they're all 6 and 7 feet apart out there. Did they make any lines? And we don't have any thermometers. And I'd already thought about that fence put up there. I thought that somebody ought to be wiping that off in between people.
She does have a point. Everybody's standing right there.
Didn't we pass an order? They've sent some of them temperatures.
Yeah.
In these county buildings last week.
Yeah, if they weren't able to get the monitors.
Still don't have it.
Checking on that.
I'll tell you, the scariest thing to me is, and I'm telling you the truth, is going to come back every year. We could be doing this all over again next year. Or it never die out. What makes it die out? I guess we're still online. I'm talking to everybody out there. That's okay. No, it's okay. It is a question.
Y'all got a plan how to get me the bills if y'all close?
Do what?
I can bring it.
I put it in the mail.
Well, who's gonna pick up the mail?
Yeah.
They don't have any mail now. You put it in the U.S. mail.
I mean,
No.
we hadn't talked about all this.
Yeah.
I say we send them all electronically. Stack them up, bring them once a month or something until this stuff goes away.
Yeah, but it takes time to get all that entered, and I have to
Yeah.
have people here to enter it,
Yeah.
or how to get it to them so they can enter it.
I don't know.
Yes, sir. I don't think we do. Yeah, please. Sir? No.
Ask him if he wants, does he have something that he needs to say?
Just ask him if he has something he'd like to say to us and be fine. Regarding the thermometers, I think you guys know this, that we've ordered thermometers. You won't be surprised to know that they're in short supply. Our earliest date is April the 9th. Would be the earliest day we expect them to be delivered. And there's all sorts of discussion about using, industrial thermometers and that sort of thing, and contact thermometers, but the prevailing opinion seems to be we need to use a medical thermometer, and it needs to be a non-contact thermometer. So, yes.
He said he's just here for resources.
Okay.
Any questions for him? He'll answer them if not.
Okay. So what I propose is that we recess this meeting. In a few minutes, we'll convene our 9 o'clock meeting. We'll conduct that business that's on that agenda. And then that depends on how long it takes us to get through that 9 o'clock meeting, then we'll set a time to reconvene to discuss the things on this 8:30 agenda. So, all right, so we're going to recess this meeting, and we're going to take about a 5-minute break, and then we'll come back for our our Commissioners Court meeting that was scheduled at 9 o'clock. Okay, so we're reconvened into this emergency meeting. Go ahead, Rebecca.
So Rebecca, I'd just like to ask, what adjustments are we contemplating in this order?
So the adjustments that I was planning on making are basically more procedural. To the front half of the header, it refers to the county judge's authority. Because you guys are taking action as a commissioner's court, I'm going to amend that so that it actually comes from the entire court, and then it doesn't have a time duration to have to be renewed. And then the rest of the changes are just within the document, fixing headers and the text so that it is uniform.
Okay, well,
So are you proposing to dispose of this shelter-in-place order? Or?
No, not at all, Judge. So
Change the-
you guys have two orders on your agenda. The first one extends your current resolution, the county judge's resolution for a declaration of local disaster. And so whenever the court approves that, then that will take away that 7-day requirement for approval. At that point, when you tick down the items to the actual order for shelter in place, if we amend the language that you guys sent before this meeting to include authorization from the entire court than just the county judge, then it can stay in place without having to be renewed at that 7-day point.
Okay, I thought we were going to renew it. I thought I was going to sign that order, and maybe I don't understand the process. I thought I was going to sign that order, and then we were going to extend it in the same meeting.
So different counties have done it different ways. Dallas County, as you guys know, the county judge authorized that on his own authority, and then the court will reconvene there and then approve any adjustments or that same order. That's an option for you to consider. Hunt County, what they did was, as an entire commissioner's court, they approved the order for shelter at home, shelter in place. So that's a secondary option. Because of the way that you guys were meeting as an entire commissioner's court, I guess I figured that you were going to approve it from the entire court versus just the county judge. But either way, it's totally an acceptable and legal option.
And if
As long as it doesn't make any difference on the impact of it and the effect of the order, it was a different.
Is this it's two separate orders you're talking about. One is the disaster declaration order, correct?
Mm-hmm.
We have to extend, and that's the reason that needs to be or should be extended is because the original disaster declaration is a really critical thing in recovering expenses and stuff like that.
Understood. And that was
if we do it as a court, you don't have to keep extending, right? So if we do it as a court,
correct.
We're not talking about that. We're talking about the original disaster
I
declaration.
know, but we're
So the
gonna
court has to
extend
either a court extends it
Right.
for a certain date or it dies.
right? And
So
we're
that's
gonna do that.
and that's a totally separate thing
Yeah.
than this shelter in place order. And so what? If I understand what you're saying, Rebecca, it doesn't have to be It doesn't have to be an action by the county judge and then an extension. That's what I thought the process had to be.
No, the court can approve it.
Okay.
So it saves you guys a step later on.
And that's the original order?
No.
So
No,
Shelter in place order.
shelter in
That's
place
the
order.
shelter in place. What about the original order?
it just stands in place. So it actually goes into effect for 30 days to have the declaration of disaster. And then your shelter in place, from my understanding, is only 7 to 14 days, whatever you guys decide.
Yeah, till the date that we put in it. So we put in March, April 8th, it ends April 8th.
Yeah,
Unless
exactly.
we extend it.
Okay. I'm sorry, I'm still just a tad confused. Apologize. And I'm sorry, I just want to make sure I understand. We have the original disaster
Correct, and it
order,
dies.
and that was signed by the county judge and must be extended.
Within 7 days, yes.
Right. So that needs to be extended by the Commissioner's Court. So my question is, does the shelter-in-place order supersede that? It serves the same purpose?
It amends and adds additional terms. So
it incorporates the original order that absent this shelter-in-place order, the court would approve the original order, which would continue it, but this new order is inclusive of the original order. Is that correct?
They're all falling under the same general authority. They kind of cannot operate without each other. So
Understood.
you are correct. However, some jurisdictions are adopting them separately and some are amending. So there's no really one way to do it. You guys can adopt them separately or incorporate them together.
So, understand. So the order as written,
They're
the
separate.
shelter-in-place order, does it merges the two orders?
Not as written.
Not as written. So
I think the shelter-in-place order, whether it's an order, an action of the Commissioner's Court or an action of the county judge, the shelter-in-place order needs to be a freestanding, separate document because it needs to be separate from the original declaration of disaster. The disaster declaration may live on. The shelter-in-place order may die or may be rescinded, and I think those two things need to be kept separate. Okay.
And I will draft them that way.
Okay.
that's where I was headed.
Yep.
Thank you.
That's what she was going to go away and do. Put it down as Commissioner's Court approval.
But just to clarify, do you guys want the shelter in place to be from county judge only or from Commissioner's Court?
If it doesn't matter, then it doesn't matter. But I thought it had needed to be a two-step process. So if it doesn't have to come from me and then extended by the court, then we can do them at one time. Okay, so we're going to go back and recess and let Rebecca do her magic.
So
So we're going to still be back at 11?
Before you recess, since she is going to be engaged in making adjustments, I'm just asking, what's the appropriate time to talk about the content of the shelter-in-place order?
I think we should wait until we see, because from this point on, your revisions are just going to be, you're not suggesting any substantive revision?
No, not at all, just procedural at the top.
So then,
But I have a couple of questions about
but
something.
y'all haven't had time to, have y'all had time to read it?
I've read
Most of it.
Sir, Judge, certainly if you guys have any substantive changes during the next portion of this meeting, we can strike through, and then you could make a motion and adopt it with those strike-throughs or adaptations, and then I'll change it.
I just wanted to make sure that y'all felt comfortable that you had read it.
Yeah.
I've read it.
Okay. Then we're going to keep in session then, and which brings us, before we do anything else, I'm going to ask Hank Murphy if he wants to come up here and give us comments on this item on the agenda.
I have no comments. I would have some questions.
Well, come forward. Tell us who you are and what you're doing here. And I guess, is it appropriate for us to answer questions right now with his questions?
Judge, the rules of procedure for the Commissioners Court would apply as they would normally. Normally, it's just limited to statements. However, it's discretionary. So if the court would like to entertain questions.
I'll make you this offer. You can ask us questions now, or you can give us comments. And then if you want to, we normally limit this comment period to 3 minutes, but if you want to do that and you want to have a Q&A with any of us individually or me or any of us after, then I'm sure everybody would be glad to answer
Fair enough,
questions.
Judge. Thank you.
Sure.
Hank Murphy from the Terrell Tribune. And the question I have is if y'all go ahead and issue this stay-in-place order, how will that be enforced?
Can I just ask a question? Are you asking as a reporter? Is
Yes,
that
sir.
your purpose here?
I'm here for the newspaper.
Okay.
I'm here to get information for our readers.
That's actually one of the things that we're probably that we will be discussing. Rebecca could tell me that I think that if a person violated this order of the Commissioner's Court, you could be held in contempt of the court. So that's certainly one.
There's also a secondary level of enforcement that I've seen in other counties and jurisdictions. It falls under 418 of the government code, so it's enhanced because it's a disaster declaration. And that would include, you guys could put an enforcement provision of up to $1,000 fine and or up to 180 days confinement. If you wanted to include that in your order, I've seen it done where it's just the fine or both confinement and the fine.
And that is not in this order right now.
Not currently in there.
But it is true to say that this is an order of the court, and somebody, if they weren't complying, they could be held in contempt. Is that correct?
That is true.
Okay. So that's something we'll have to discuss as to what we're going to do as far as enforcement goes.
I see. And these questions don't really pertain precisely to the order in place or shelter in place, but have you all heard anything about testing capabilities in Kaufman County for people who think they may have been exposed or people who they know may have been exposed?
I think I would refer you to Dr. Brazier, and I think he'd probably be happy to answer those questions because he's the one who would know that more than we would.
Okay, and then final question, Judge. Have there been any cases reported yet in Kaufman County?
As of this morning, we have no confirmed cases in the county.
Okay, thank you. I think that's all I've got. And one other thing. Hospital beds. If this does spike, does Kaufman County have adequate hospital beds to take care of the people who may need to be hospitalized?
We asked Dr. Brazier that question this morning, and I think generally speaking, we've got 120,000 people in this county, and the only full-scale hospital we have is Presbyterian. I asked him how many beds there were in the hospital, and he said he didn't actually know that off the top of his head. But the point that he made is it's not particularly how much space you have, how much bed space you have. It's more about personnel and your ability to staff it. So he said you can go on the website and see how many beds they have because that's some sort of regulatory requirement. But I don't think it answers the question about their staffing, which is a moving target right now.
Right. Okay. Thank you very much. Appreciate it.
Thank you very much, Hank.
Yeah.
Okay, so can I suggest that we use this shelter-in-place order as our starting point?
Yes.
And I would suggest we just kind of go through it page by page. I apologize for the paging at the bottom. That obviously the paging came off of another document. So this is page 1, not page 11. So let's just talk about do we need to talk about any of the stuff on the first page, or do you want to move on down to the action part? What do you want to do? We'll start with Commissioner Precinct 1. You got any specific comments on this, Doc?
On A, 1 and 2, no, it's just basically the same stuff we're doing right now.
Yeah, items 1 and 2?
Yeah.
Yeah.
I mean, so I don't have anything on the front page.
Okay. Anybody else have anything on 1 or 2?
No, I do not.
Okay, then I guess, then of course you get to the definitions, and then you get down to the purpose of this order. I will talk about the essential businesses. One of the errors that I've seen in some other counties is they tried to go into a listing of essential businesses, and they missed some things. So actually, Representative Bell sent me this document, which I referenced, that's referenced here, that they have a much more comprehensive list and description of what essential businesses can be, and so we just took that basically almost verbatim from what this Homeland Security document said.
So that's what's in the following pages, is this?
Yes, all of this comes out of this Homeland Security document about the title of the document is critical infrastructure, but then it breaks down and it goes down into really what you're seeing right here, which is it describes essential businesses and essential jobs.
Yeah. I mean, basically, when I read through it, it says it's okay almost for every necessary item that we need to live and strive. I mean, I don't know very few things that you leave out.
No, and I think it changes over time. I was just talking about having heard a conversation, a Q&A with the county judge in Dallas County, and one of the subjects that came up was about lawn services.
Yeah.
And the lawn service may not be essential today, but after a period of 2 or 3 weeks or 4 weeks, it's,
They might be getting a ticket from the city.
Well, yeah, I mean, it's going to become essential, so it's not an easy thing to define.
And I'd ask about, because I had a constituent over in my area that has garage door business that, that's their whole livelihood, and back at the back, I mean, it says any essential needs of any business or household that needs their work, any kind of work to maintain their business. So that kind of means a plumber, a hot water heater. It means if the garage door can't open where they can't function,
Yeah.
then that's legal for them to have.
Yeah.
So, I mean, just because it doesn't name you doesn't mean that you're not a viable business that can operate for essential services.
I think we could probably all come up with businesses and services that would be hard to define as essential. I mean, I wouldn't want to do that now, but I think you could probably do it on your own.
I think so. I think it's.
Well, in that B2, at the last sentence, any additional businesses or related determinations shall be made by the Kaufman County Office of Emergency Management.
Mm-hmm.
How do you see that playing out?
The way and this is what Commissioner Gates was talking about earlier, and this would be a good thing for us to discuss. I think there's 2 ways. There's going to be something to come up. Use the lawn service as an example. If this thing goes into May, and people in the lawn service business someone in the lawn service business comes and says, I have, 200 residences that I take care of. These people don't have any ability to mow. They don't have any equipment to mow their own yards. And they're, the grass is now, a foot tall, which creates obvious health issues. So the way one of these things could be handled is that could be brought to the Office of Emergency Management, which really, that office really that definition really is Steve and me. There would be times I think we would consult with other people, obviously Dr. Brazier, if it was relevant, sort of thing. So we could be, emergency management could be entrusted to make those decisions, or we could convene as a commissioner's court and address those decisions. And it doesn't make any difference to me how we do it. It seems like there's going to be times when it may be a fairly simple and easy, quick decision that's not going to require a lot of deliberation. But I don't know how to define those. I think y'all need to decide.
Yeah, I know Forney said something about a waiver or something. This is basically the same.
They have a process. Well, actually, and I did not see that in there. That lady was talking about that. I did not see it. It's not in their order. I think they took that out. But what they were planning to do was to have a waiver maybe they did, but what they were planning to do is put in their order a waiver process where that waiver would be considered by the emergency manager and the city manager, that they would consider the case that this person made. The example that I had with the city manager of Forney, I said, well, give me an example of what you would consider waiving. And he said, so if you have a large manufacturing facility with 30,000 square feet and 10 workers, and they could show you their plan to keep people
apart,
50 feet away from each other all through the day, where they wouldn't even come into contact with each other. He said that might be a situation where you would grant them a waiver, and maybe the same thing for us.
Yeah.
So
my concern, Judge, when I read this, I wasn't clear, the definition of Office of Emergency Management, because I really believe that that there should be at least a mechanism where exceptions can be made on a case-by-case basis. But I really felt like that an elected official needed to be a part of that process.
How about if we change that language, just for total clarity, we change that language that determinations would be made in consultation with the county judge and the emergency management coordinator?
I agree with that, but I would also, at least on a precinct by precinct basis, I'd like to be made aware and at least be able to discuss with you to either advocate for or against a particular application.
How about if we said that if it's precinct specific, and I'm sorry, Rebecca, we're just adding all this language in here for you to work out, but if it was something that was specific to a precinct, that decision would be made with the commissioner, the county judge, and the emergency management coordinator.
That'll work.
If it was precinct specific.
Yeah.
Some of these things,
Yeah.
lawn service, going to maybe go over
Right, understood.
all the county.
Well, we probably ought to adapt in the lawn service before we even start. We could stop that one, make sure that it.
I don't want to get down into that level of detail because I think.
No, I know, but I
yeah.
mean, that's a pretty big one.
It is a big one.
It's, because I noticed that the judge in Dallas immediately reformed his instantly to say.
Well, I'm happy to add that if you want to add that.
Was essential.
I'm happy
For
to
health.
add that if you want to add that. Or Rebecca can add it.
And that's probably also prudent because we do have in this county two commercial golf courses that
Right.
probably need to be able to at least, even if they don't operate, I'm not sure how this would impact their operations, but they probably need to be able to perform routine
I don't know if
maintenance.
they operate or not. They're not, I don't guess they're essential, but they're definitely outside.
Yeah.
And probably have distance. But,
Well, let me be a naysayer, and don't throw anything at me when I ask this, because I'm just, we've got the shelter in place, and we've asked everybody to basically shelter in place now, maintain 6 foot, it's the social distancing and everything else, which the shelter in place order actually supports, right? Mm-hmm. So, and if we're going to find, I guess there's really very few functions that are essential. Is there a way we can educate the plant managers and stuff, even if they reduce their workforce, went to 2 shifts instead of 1 shift, where we can all work together where they can still have some income coming in and the employees still generating their own income and working, and we can kind of meet halfway where, if we have 1 shift, we just open from the morning shift, and if they put in 2 shifts where they can do their production and limit their amount of space their employees and spread them out, if it's possible, or educate them on sanitary precautions and stuff like that. Of course, there's no governance, and it's all on the honor system, which is the way we're operating now. And even with the shelter in place, we're really operating on the honor system that they're really going to shelter in place. I haven't seen a whole lot in here that's any different than what we're doing already. And believe me, I understand the importance of what we're doing, because I don't think Kaufman County is where we're going to be in 2 weeks. I think the dynamics can be fast paced, and we can go from sitting here with nothing to being overrun relatively quick. So I understand the importance of what we're talking about, and I believe in it, but is there really that big of a difference between the way we're doing things now and the shelter in place?
I think it's a messaging. I think that what this order does, it's important. And we talked about enforcement and what a challenge it would be to actually have to enforce it. Although unless you had somebody who was being
blatant.
just blatant about it. But I think this does send a really important message to people. And I think the prevailing will of our residents feels like we need to send that message.
I know one thing. I think just the news media and the county judge of Dallas talking about it all weekend has made a difference, because I know everybody doesn't come from Forney, but I know our clerk, our county clerk, Laura, and me both came from Forney, and that was the lowest amount of traffic I've seen in 15 years. So I think it's having an effect already. I think people are really starting to understand that they really do not need to do that, have all these groups of people. And so I think people are maybe a little bit more intelligent than everybody gives them credit for. So I'm hoping that they keep up this. I hope they really understand that that's the main way that we're going to block this and drop this line and flatten it out, is by separating and not transmitting this virus to one another. So, we're just agreeing with him. We're agreeing with Dallas. We're agreeing with Hunt. We're agreeing with Rockwall that we want to do the same thing. We want everybody to let's break this strand and this disease as fast as we can.
So I'll agree with Commissioner Hunt that we need to be able to work with the community, and I think this exception process will serve that purpose. And I know it probably doesn't need to be in the language of the order, but I think there needs to be some sort of we need to at least publish some sort of procedure to allow that exception purpose. Make an email application to the Office of Emergency Management or whatever that might be. I think we need to have some sort of implementing policy, outside the actual order itself. But I think that would go a long way towards what Mike is talking about relative to trying to be able to work with our industry. At the same time, to paraphrase what the President said yesterday, and really to agree with you, Skeet, that we can rebuild the economy, but we can't rebuild a life that might be lost by a failure to act. So, and lastly, I think that all also rolls into this, and I know Rebecca mentioned it earlier. An order is only as good as either voluntary compliance or the ability to deal with someone who egregiously violates it. So I would suggest that the same provisions under whatever code that is, Rebecca, the $1,000 fine and the 180 days, at least be included. Obviously, and I think I'm sure the sheriff would agree that'd be the absolute last resort and would require some sort of incredibly egregious disregard for common sense. But I think that if you're going to draft this order, you ought to make it comprehensive.
I agree. I don't see any harm in putting that in there. And as always, like everything, the law enforcement body has the discretion. They have the discretion to take all the factors into account when they do something. So, Sheriff, do you have any comment on it? I mean, do you have any object to us putting that language in there?
No, sir, but before we take any action, I'll bring it for the judge and emergency man before we do anything.
Right.
We're not going to just go out here and try to enforce this.
Absolutely.
No way.
Yeah.
We're just trying to get compliance with people, and that's all we're going to do.
Good. And I think it adds weight to the message to people.
Well, I think it would also add weight to a business that is not supposed to be open. All of a sudden, somebody opens up the skating rink. We need to be able to go over there, and sheriff needs to visit them. And if we have this enforcement, then
Yeah, and right. I mean, if we don't put it in there, the sheriff really doesn't have any. There's nothing he can do about it, really.
And I agree that I think that we ought to have some kind of outline for this, a waiver or whatever we want to call it, to get an exception.
I think we can come up with that,
Right.
like an administrative level, without putting the details.
And I
in there.
agree with you. I think it'd be a great idea to have the commissioner of that precinct if it's some business in this precinct.
Yes.
Because obviously we're going to see somebody again.
Yeah.
So you know, it is what it is. So I think it'll work.
This is all uncharted territory.
Right.
I mean, really, it's, and
Exactly.
and for us, and all I can do is relate it to is my prior life. I mean, you pull up to an apartment complex at 2:00 in the morning, and you got a lot of heavy smoke and fire, and you have to rely on what experience you've had dealing with apartment complexes. And if you don't have that, then you've got to rely on all the training you had and all the stuff that other people have taught you. So what's happened everywhere else across the world is telling us what the possibilities are here. And we just have to make the best decision we can. And I understand the severity of it, and I don't want to make light of shelter in place, because I do believe it's important that people understand how important this is for everybody's safety here. So, I mean, so I don't want my statement to come out like I don't
Sure,
care.
I understand. No, I understand.
No, everybody cares.
Yeah.
This is a very, it's a burden for people, and we should be hearing all points. How are you doing over there, Miss Rebecca?
Well, luckily, I've got some colleagues that are typing as you guys talk, so I think we're getting a little bit closer. I also added in swimming pool maintenance. I know that that's something Dallas County had done based on mosquito health.
Yeah.
Right.
So, just to make sure you're okay.
So,
Becca, is this order will continue until rescinded? Is that the?
I would suggest placing a deadline date on the order.
we had talked about, and we had had discussions about setting a date certain, which would be a regular scheduled commissioner meeting on April the 28th. I think that's too long. I think we need to revisit this. I don't think it matters when the Commissioners Court meeting date is anymore. So,
No, we're going to have one.
yeah, I think 30 days is plenty of time. And I don't know, are you looking at a calendar or anything to come up with? Do we want to put some sort of at least reconsideration date in there so people know that we're going to be reviewing at a certain day?
What do you think we ought to go back to at minimum meeting once a week, just to cover all this?
I think it's irrelevant because we're going to be probably meeting more than once a week anyway. I mean, we're going to be doing emergency meetings probably.
Yeah. We just need to assess it and play it by ear. If it spikes, and then we might have to get more severe.
Yeah.
What we're doing.
I do think if y'all remember, when we went to every other week, everybody I think all tacitly agreed that we're going to hold their Tuesdays available for regular Commissioners Court meetings. So I think that's maybe the best. Keep those dates, but I think we will before the end of this week have whatever technology that we need at whatever place it's going to be where we're not going to have to be meeting in person. So you can quit worrying about me, Skeet.
I'm not worried about you.
Just making this 30 days.
Worried about me.
Is that, or what do you recommend, Rebecca?
I would recommend 10 to 14 days.
I don't think based on what I've read, I don't think the virus spread curve is going to be much revealed in 10 to 14 days.
My suggestion is only based on surrounding counties and different jurisdictions and what they've put in place.
Yeah,
You guys are welcome to adapt.
Did the city of Forney have a date on theirs?
April 8th.
April 8th.
How many days is that?
It's like 10 days.
15.
Yeah.
I tell you, I think it would be valuable for us. I sent this document to all the cities yesterday. I think it's going to be really helpful if we can all sync up what we're doing so that order in the city matches a lot of what we're doing. And so I'd say we ought to adopt that same date.
And I think you guys need to be aware that the county's order would trump the city's jurisdiction.
Sure, right.
And we can extend it at any time if we need.
Sir?
We can extend it at any time.
Right.
Makes perfect sense.
So let's sync up with what that one city did, and I don't know what the other cities have done, but we'll stick with it. We'll try to do the same
I
dates.
don't know what Rockwall County did theirs too, and did you notice what their date was?
I haven't pulled Rockwell. I know Tarrant just set theirs at 10.
I saw it and I didn't. So,
Collins.
But that's all right. I mean,
But when is Dallas?
renew it.
order?
We
What's
just
the
renew it. It's
Link
not
to
a big
Dallas's
deal.
order.
I don't know.
We can renew it before that, or we might know in 7 days from now, April 8th's not going to make it. You know, we might.
Yeah,
we
certainly makes
we have
sense.
no clue what. But I think when all the testing starts coming back, is when it's going to get the numbers up.
I got one thing. I know time's a factor here, of course, but the lady that spoke this morning making suggestions for individual businesses to come up with their own plan or their ideas of doing things. Does anybody think it might be a good idea to maybe solicit input from our Chamber of Commerce, since they represent a lot of these businesses in a way, I guess? Maybe we could include them in some of this and say, okay, look, this is what some people have suggested. If we put this out as kind of a guideline, say if you do these things, then yeah, you should be able to operate your business and everything under this current order. And just give them some guidelines, not necessarily give them some rules to go by. But I mean, does that sound like a fair thing to?
I think that could be part of this application process that we do, where we offer them, if you're
Bring in a plan.
If you're running an ant farm or something, we're probably not going to consider your request.
Yeah.
But
one thing that struck me was
skating
she was talking about especially like hair salons, for example. I know those folks are on a pretty tight budget as it is, and if they restrict the number of people that come in, at least they can support themselves and their employees can still work. Maybe if they cut it down to a certain number of people in the building at a time or whatever, because.
No, I think we should put some. Come up with some ground rules for what would be considered.
Okay.
But if it does spike, we have the latitude to shut the door.
Right.
Yeah. It'll be. I think we put a date certain on everything. If somebody gets an exception, it'd have the same expiration date as whatever our current order is.
Yeah. And like I said, if things get really, really bad, if overnight, we have 10 cases pop up in Kaufman County, then we can rescind all that and change it. So, yeah.
Okay, Rebecca.
I've got my marching orders, so I'm good. Let me go back and retype it. Do you want me to disseminate it to your office or everyone?
I don't know. I mean, do we have to have these details worked out, or can we take an action to? Can we go ahead and take action now with the document that we have, subject to the revisions? No?
My preference is for you guys to have the actual document.
Yeah. Okay.
I'd prefer to.
How long do you think that will take? When should we reconvene?
I'm looking at my phone because I've been texting Debbie the change orders. At least 45 minutes.
Well, it's 11:15. We'll make it 12:15. Okay.
Sounds great.
Man, and I thought that whenever this commissioner's job was just working on roads.
Yeah, that's all we're supposed to do, isn't it?
Okay, so we're going to recess, and we'll be back at 11:45. Everybody ready? Okay, so we are back from our recess into our meeting, emergency meeting that started at 8:30, and so we're back. One of the things that happened after we left, Steve and Rebecca, Steve, our emergency manager, and Rebecca, our civil attorney, got together and did some research, and I think Rebecca's going to brief us up on what you found out.
I do have more of an update on that. So in our discussions, Steve and I were going through different jurisdictions and counties that have already put these orders into place. And we noticed that most of them are doing that through the authority of the county judge. So I wanted to walk back through some of my previous statements about 418 and give you guys additional guidance and then maybe some potential options for moving forward. So under 418, it's an interesting statute that provides a lot of executory power versus legislative. So you guys, as the Commissioners Court, are more like the legislative body of the county. And so whenever that statute gets enacted, it empowers the county judge in order to do more unilateral orders. And so you'll see some counties acting through their county judge and then some doing it through Commissioner's Court. The recommendation from Steve and I, in order to facilitate the situation, because you guys know it changes every day, even every hour, the county, using the county judge's authority as a signatory would probably best facilitate those circumstances. And the way you can do that is currently the county judge has made a declaration of disaster, and that order has to be extended within 7 days. And so that's on your agenda today to do that. It will extend it for 30 days, and then under that point, the county judge could act under 418 to issue orders like shelter in place unilaterally versus coming back to the Commissioner's Court. Previously, we had a lot of discussion about it being mandatory to come back to the Commissioner's Court. That case law is very gray, and we believe that you can, as the county judge, do that without returning unless the Commissioner's Court indicates that they want to take up a specific issue and remand it or rescind it. And in so long as that emergency declaration, that blanket order is in effect. So does that make sense, or have I clouded it more? Do you guys have any questions?
I guess the only question I would have is, is there any way that we can discuss something before the order is put out there, so at least we all know what's going on? Because people are going to be calling us and saying, hey, what's this all about? And if he's made an order, we don't know. I mean, is it legal for us to even discuss that outside of the court?
So not in a quorum setting. You'd have to call a meeting in order to discuss it. But the reason why that statute is so powerful for these different members of, the governor or county judge or a mayor, it's just because the situation can change so quickly that action has to be done immediately. If an action is taken that the court does not particularly care for or maybe wants to adjust, they can call that item back and do that.
So they can, the Commissioner's Court meeting could be called if they could rescind that just within that hour or whatever of the emergency meeting notice.
Yeah, it's a check and balance system. And Judge, do you want me to walk you through the two drafts that I handed out?
Could I just ask a quick question?
I don't know that that's necessary because I think it's not that different, really, is it, than what we had before?
The only difference is one's expanded and one's condensed. So.
Okay. Walk through the difference in the two, and then see which of these options the commissioners.
Before you do that, just back to the previous issue, just for clarification, what's the process if the court decides to rescind the judge's order? How does that happen? How's a meeting? What's the procedure to call a meeting?
So the standard procedure would apply that any commissioner's court, commissioner's member could request an agenda item be placed on the court's agenda for consideration. So you would just do that through the judge's office, through his administrator. I don't think the judge would be contrary to administering that process.
But that's just to place it on the regular court agenda, right? Is there a way for the court to call an emergency meeting?
I think the same standards would apply for a normal emergency meeting, that you guys would call that upon request. If the judge received that request, that he would call that meeting into order.
Okay, so you want to tell us what the difference in these two documents is?
I can. Okay, so one is drastically longer than the other. What I did, and you guys may or may not like this, so I wanted to give you the two options. In looking at a lot of the different orders and doing a comparison study, most of them are within 10 pages. And so because I know that this document will be widely circulated and looked to for information, you kind of have the option to go extremely detailed or more overarching. And the condensed version just integrates the CISA critical infrastructure, those 16 critical infrastructure sectors by reference, and then it includes a link to that PDF document. And it says that that document is intended to be guidance regarding permissible and necessary operations versus outlining and including all of them. So it cuts like 11 pages off of it.
So the question is, do you want us to just reference that CISA, that Homeland Security document, which is, there's a link on page 5, or do you want to go and outline everything that document has in it as far as essential services goes?
I don't think people are going to take the time to go to that website and look. They're going to call you or Steve and start asking questions when it might cut down.
So you think the length of your document is better? Did you go ahead and put the detail out there?
I think if we have it out there, then, because, I mean, they're not going to go, I mean, unless you want to talk on the phone a lot more. I mean, that's up to you, but you might weed out some of the phone calls if they actually.
I'm going to transfer all my calls to Steve's office. What do y'all, the other guys, what do y'all prefer, the lengthier, more detail?
I think the more information we put out there, the better.
Okay.
Well, and also,
I agree.
Dallas County, I've noticed over the last week, they put out the short version to start, and he constantly
Has to come back.
answering each one of them.
Yeah.
Okay.
And they said that they've been numbered by hundreds of calls over the short.
Well, that's not going to be helpful
I know.
at all. So,
I know.
okay, I think Rebecca, then everybody liked it.
But you have all the answers in this one.
Yeah.
I mean, that's the thing. You can say, well, here's a copy. I'll email it to you.
Okay.
I'm
right.
getting more for shorter, but this in this case, it might be better to have the lengthy copy.
So, go ahead.
Where's the language about the exception?
About the what?
About the
The way they
waiver?
So that language is on page 4. And if you'll look at underneath number 4, essential
see it.
businesses.
404, yeah.
Yeah, page 4 of 18.
Oh, I see it now, yeah.
And we will just agree that in precinct-specific issues, the county judge will consult with the commissioner?
That would be my commitment if it was precinct specific. Steve and I wouldn't want to do anything that you were not aware of.
I would recommend an administrative policy similar to the one in place for development services, where when it regards that precinct, they're just CC'd and emailed. So if emergency management could facilitate that, I think that would probably help your issue, Commissioner.
Yeah. No, I feel very confident in the judge's commitment.
Okay. Thank you. All right, so let's kind of, if y'all are ready, we'll move on to get back on the specifics of the agenda. The item 2 on the agenda was consider extending Kaufman County's declaration of local disaster for public health emergency issued by Judge Richards on March the 18th. Rebecca or Steve, you might be, either way, you could tell us what this does and talk a little bit about, this would be your chance to hammer everybody's attention on documentation and funding and that sort of thing.
Well, we're at the point where the original order that you signed will expire. So to keep this in place, we have to approve that extension today. Having that declaration in place will allow us to get reimbursement for anything. Right now, everything that's considered an protective measure it's already been approved to get reimbursed for. So if we get gloves, masks, gowns, anything like that, cleaning supplies above and beyond what we would normally use, we get reimbursed for that. They're looking right now at laptops for doing the telework. They're looking to see if there's a way to reimburse us for those. That hadn't been decided yet. But everything I'm seeing from FEMA, and they're starting to push out the forms we'll need to, take our costs, document them, and we'll have the forms very shortly to start making submissions to get that money back.
But if we don't have a declaration sustained, then we're out.
If we don't have a declaration, that goes away.
Do you know if all of our cities have issued a declaration?
Not all of them. Right now,
But they're in the same situation, right? If they're expending funds and they haven't got a declaration,
that is correct.
Then they're not going to be in line for funding.
So right now, Forney, Terrell, and Kaufman are the only ones I know of.
Maybank has?
Yeah. Okay. So those are the only ones I know of right now that have issued a declaration. And after this, I will get with the others to make sure that they're aware of the situation.
And probably just maybe help them understand what the necessity of it. Because they could very well spend money on their own that wouldn't have anything to do with the county.
And that's a disaster declaration. That doesn't extend to the necessity for a municipality to issue a shelter-in-place order.
That is correct.
Disaster.
Just a disaster.
This is really about money, really what it's about.
Yes, sir. Yeah. Now, the judge's order will take care of the cities unless they choose to issue their own order. It can't go above what the county has issued, but if they want to tighten it, they can do that.
Okay, any questions for Steve? Rebecca?
I do not have any questions other than thanks, Steve,
Okay.
for your help.
Okay, so item 2 is discuss, consider extending Kaufman County's declaration of local disaster for public health emergency issued by Judge Richards on March 18, 2020. Is there a motion to extend?
I'll make a motion.
We have a motion from Commissioner Phillips to extend the declaration. Is there a second?
I'll second.
Second from Commissioner Barber. Discussion? Those in favor signify by saying aye.
Aye.
Those opposed, no. That motion carries. And then the next item is discuss issuing a shelter-in-place order under the authority of Section 418. I'm going to read this, .108 of the Texas Government Code. This is, of course, what we've been talking about. Is there a motion? No, that's not correct. There is no motion to come forward on that because what we're talking about is I just signed the order, so it's discussion only.
That's correct.
Okay. Does anybody want to discuss this some more? Or we discussed it? Okay. Then I'm going to go ahead, because that's pertinent to the next item. Or is it pertinent to the next item? It's not. It doesn't matter, does it, Rebecca? Because there's no extension required because this is under the umbrella of the original declaration.
That's correct.
Okay. So there's no necessity for that. I think we've completed our agenda.
So I'll make a motion to adjourn this meeting finally.
Commissioner Phillips makes a motion to adjourn the meeting finally. Is there a second?
Second.
Second from Commissioner Cates. Discussion? Those in favor signify by saying aye.
Aye.
Those opposed, no. That motion carries. I think everybody should go out and get some sunshine.